Good morning and welcome to this week's edition of The Scots in Us. I'm Camilla Hellman, President of the ASF, and I could not be more delighted that we are speaking this morning with one of our partners, which is the Prince and Princess of Wales's Hospice in Glasgow, affectionately known as Glasgow's Hospice. But I'm being joined by Noreen Preston, who heads up the philanthropy for them, and Dr. Sheonard Laidlaw, who is the clinical head of young adult care and the program you have there, which is very, very unique. And I'm so very pleased that we're going to be able to talk about this because it is something that is so important. So I'm going to hand over to you two to ask if you could begin by telling us how the hospice came to be and what it really is focused on doing, because it's a wide range. So over to you, Noreen.
Thank you very much, Camilla, for having us. It's a pleasure to be on here and to try and reach some of our American supporters while we're here. Yes, as you said, we're affectionately known as Glasgow's Hospice. We're a very special, I may be slightly prejudiced, but we're a very special organisation here in Glasgow. We provide free, compassionate, person-centred palliative care to over 1,200 patients and their families each year. So we support people living with life-limiting or life-shortening conditions, and it's very important to us that we really look after the families and their loved ones as well as the patient. And I have a personal experience of having been a loved one of a friend who was here and received phenomenal care here, and as did we all receive that phenomenal Glasgow's Hospice cuddle and care that goes along with that. So I'm so grateful to have that personal first-hand experience of it. I'll hand you over to a professional in the healthcare to tell you more about the services.
Thanks very much, Camilla. We have a number of exciting services here at Prince and Princess of Wales that, as Noreen said, support not only the patients but also their families and loved ones. From our community team, which supports patients in their own homes, to our Living Well hub, which is an outpatient sort of model that they can come and meet our resident artists. They come to see our music therapist and really enjoy that sense of overall well-being when you're living with a life-limiting condition. We also have outpatient clinics and into the inpatient unit ward. The young adult service is something very, very specific, but perhaps we can talk a little bit about what makes us special in Glasgow.
Absolutely.
When you speak of the young adult service, what exactly is that and how is that helping? I'm so delighted to hear you speak so strongly of the family care, because if the family can feel better and stronger and understand how they're so important, they can help the patient as well. But can you explain a little bit what that is?
Yeah, so obviously we actually care for patients over the age of 16. Our young adult service so focuses on those between the ages of 16 to sort of 42, and all of those live with a life-limiting condition, which is a condition that will shorten their life, but they may well live extraordinary and active lives while diagnosed with that condition. And we are the only service in Scotland that has a young adult service. So we are pioneers changing the face of young adult care here. None of our patients have a cancer diagnosis. They all have conditions relating neuromuscular genetic diagnosis, including Duchenne muscular dystrophy or spinal muscular atrophy. We've also got young adults who have neurodegenerative diseases like juvenile Huntington's, but we have the more complex young adults who have either genetic or acquired injury, including cerebral palsy, complex epilepsy. So we have two distinct cohorts of individuals, Camilla. We have the gallus young men who have Duchenne, and then we have the population of young people who unfortunately have no verbal communication. And so it's their parents that really advocate for them. but our gallus young men advocate for our other young adults, which is actually beautiful to behold. So we very much support the young adults, their families, and also their siblings, whether that be in school or the community or in outpatient clinics or in the inpatient unit as well.
Have you always had this as part of the program, or has this been something that has evolved?
It's evolved and it's still evolving, which is really exciting. That's why I love being part of the service. The Prince and Princess of Wales identified in 2014 that there was a real need for a young adult service because of changes in the children's hospice service space. And really since then, we've gone from 18 young adults to 57 young adults. And the numbers are just increasing year on year.
And Camilla, just to help you understand, this is a service that's entirely unfunded. So every penny that it costs to do this, we must fundraise or, you know, bring in as part of our income generation policy. It's such a vital service because it doesn't exist anywhere else in Scotland. And as Sheonard was saying, you know, at 16, these young adults fall out of the system, and there is nowhere.
And their family falls out of the system.
Family, exactly.
Yeah.
That's what's it gets lost in this, is because of all the cutbacks. The family is no longer being helped.
Yeah.
And the families will well describe it as being on the edge of a cliff or being in the middle of a black void or hole. That's how alone and isolated they feel while living with the challenges that a complex child with medical conditions brings them.
I think this is so wonderful, and I do have to ask you a couple more questions. One was, did you see a huge increase of this around COVID? Because people must have felt even more isolated. Were you able to do any clinics, or how did you handle it?
Yeah, so I was in a unique position, Camilla, because I myself was shielding with my daughter. So working from home, we had to adapt really, really quickly to COVID. And you're absolutely right. The families and the young adults were exceptionally isolated. So we had telephone consultations. We were there by telephone. We also really quickly set up some social media groups and had things like coffee and cake with one of our team. Good. Or we started mindfulness sessions or art sessions. So we really, really quickly adapted, which I think is one of our strengths. Not only as Prince and Princess of Wales, we're very good at collaborating and networking, but we're also really good at adapting and improving our services.
Well, this is just so incredibly heartwarming to hear of what is going on. I've known of what incredible work you've been doing, but with COVID and everything else, you sort of dropped back away from us over here. But I'm so glad, Noreen, that you're going to be visiting back again and doing some conversations. I think that's wonderful. And for any of us who would like to be helping and supporting within the Scottish American community here, how can we do so, and how much is it costing for a young adult to be receiving care, either in an inpatient or one of the outpatient type, community efforts? You have any?
Yeah, for the young adult service we run, it costs us approximately $20,000 per month to run this service.
For the whole service?
Yes.
To run the service. Okay, good. That really was staggering. But 20,000 sounds wonderful. And how many adults are covered by that?
So that's 57 young adults currently.
That's incredible. That's wonderful. So for sort of 250,000 a year, you're taking care of all 57 adults, which is fantastic.
And I suppose just to clarify that all of that is outpatient based. It's only as a young person becomes more unwell and needs their symptom managed that they come into the hospice. So we have fewer numbers coming into the hospice for symptom management and end of life care. It's all very much done in our Living Well hub, our social hubs, where they have the opportunity to meet the artists, the music therapists, have complementary therapy. One of the things that they really miss as they leave education is the opportunity to achieve and to learn and to socialise. So we have a hub on a Monday that the young adults come to, and there is much fun, many smiles, and even some flirting that goes on.
Much merriment. I have been fortunate enough to be in some of the music sessions on a Monday and seen a brand new participant come in for the young adult service. And obviously, you know, with her health conditions, she was shy, she was reticent, her mum said she was frightened to come into a new environment. And within 20 minutes, you know, the sparkle in her eyes and the joy in participating in something, you know, independently and having that opportunity to build a friendship in the room, and, you know, not being alone while while having her condition, it was honestly quite magical to witness.
Well, music is such a key to autism, to all these different things of bringing people out, and for us to heal as well when we're in fear as well. So that's incredibly important.
We're very fortunate to have our in-house music therapist, Callum, who's fabulous. He's wonderful with the inpatients as well, but with the young adults, he's wonderful, isn't he?
No, he is
very special. And he's the cover boy of our latest Hospice magazine. Yeah. So I'll bring you some.
Oh, good. Well, we look forward to seeing you in New York, and maybe we can continue the conversation with a follow-up and a spotlight to more. But thank you so much for sharing this insight into all your very important work at this time. Thank you both.
Thank you. Can I just quickly tell you how you can help us?
Yes.
Yeah. So obviously it's wonderful to open new circles of new supporters. We had some supporters out in New York in the past. We ran a very highbrow event several years ago in the Winter Gardens in Central Park, but we're not looking to do anything like that, you know, on a short-term basis. But what we want to do is, we had such a warm reception during Tartan Week when we come out, and obviously we're in very, you know, Scottish circles, and there's such a love and such a warmth for, you know, back home, that we met lots of people who showed an interest in wishing to support us going forward. And, you know, that doesn't always have to be with money. I mean, money's always welcome, especially in these times, but just to introduce us to other networks, to introduce us to people that may be of interest to us, that might want to support us, to attend some of our events, or even to share things on social media, or to link up digitally on, you know, LinkedIn platforms or social media platforms, but just to share our story and bring the awareness of who we are and what we do in our much needed service.
And so, just in closing, Noreen, can you tell us how people can support this wonderful and be in touch with you, this wonderful challenge you're meeting?
Of course, yes. My email address is noreen.preston@ppwh.org.uk, or we will provide us a QR code that you can scan and connect with me. And we're so fortunate and so grateful of wonderful connections we've made out in New York over the past year or so, and fabulous generosity from partners. We're working obviously with yourselves at American Scottish, which has been fabulous so far, and also people like Edrington have been kind to us, and they are opening our circles to other new supporters, hopefully with a view to raising our profile in New York. So thank you very much for that.
You know, the wonderful thing about Scotland is it's got such a huge heart, and it's such a strong community. And Glasgow is such a pull on so many. And so I'm so glad that we can get the word out, and that will happen. We will put up your QR code, and we'll put up your email. And so thank you to both of you, and to seeing you very soon. Thank you.
Thank you very much,
Thanks,
Camilla.
Thank you. Bye-bye.
Hi, I'm Callum Frame. I'm the music therapist here at the Prince and Princess of Wales Hospice. Yeah, so I had my second year placement from Queen Margaret University here at the Hospice, and that was my final year. Yeah, it kind of went really well, and I think people saw the impact of it at that point. Mondays I'll typically work with young adults, so we do a couple of groups. And then I'll have other referrals maybe from Family Support Service. Thursdays, my other day, I spend some time in the ward in the morning, so I'm usually available to patients there to have like one-to-one sessions in the room, or we'll sometimes do like live music in the main ward area. And then, yeah, Thursday afternoons I'll kind of see other people that have been referred maybe as well. And we're just starting to work with Live and Well Hub. Feedback that I've had is like it's improved self-esteem. It's kind of been a way to understand themselves better and kind of look at their identity as well as someone who's maybe lost someone, and what does that mean for them going forward, kind of navigating through their grief in that way.
I just didn't know what the future held for me. You know, I had lost my husband, I lost my mum before that, and I didn't know what path I was going to take in life, so I was a bit lost.
If you've lost someone that you love, and what you would get from music therapy, it might be a way to kind of maybe start to make sense of your grief a little bit, or to think about moments that were precious to you with that person that you want to hold on to.
I don't think of myself as a very creative person, but he just kept gently pushing me. And one session when I went home, the words just kept pouring out, and I wrote. I wouldn't say it was a poem, but I just wrote. Everything came out, everything I wanted to express. So I think the next session, Callum asked if it would be okay if I shared that with him. And then by the last session, I just put music to it, and the two of us recorded a song in the last session.
You're experiencing something together through music, and then it's almost like music is a way of knowing, and for people that can be quite a profound experience of, rather than sitting across from someone telling them what the issue is, or what they're going through. I
would say he just kept guiding me gradually, slightly pushing me out my comfort zone every week, but gradually building it up until the last session was just amazing. People should support the hospice in any way they can, because to support people at their most difficult, lowest points of life is just incredible. There aren't actually words to express it really, because the support from the hospice right through the stage. I mean, I was offered aromatherapy sessions. There's a lot of choices for people to support them, and the atmosphere, the staff in the hospice, in a way it doesn't seem like a hospice. It's just full of love and encouragement and help and support, not just when people are going through terminal illnesses, but continuing afterwards as well, which I didn't know about and have just found incredibly helpful and supportive.